swiftly on. We're going to hear now from Sandra Shafii, who is involved in the Motherwell High Street DFC project, which I understand has been running for a while, has it, Sandra?
It has. We launched in September 2012, so we've had a couple of years.
Over to you, thank you.
So basically, I'm going to tell you a wee bit of a story more than anything else. And I'm not going to go into great detail about what we did in Motherwell. I've spoken about that quite a lot. If anybody wants to know detail about Motherwell, you can come and maybe ask me, or I can send you some stuff in due course. But I just want to give you an update of where we are, because we've been working for a couple of years now. And interestingly, with the morning, I'll give you some numbers. That's the analytical part of the brain, but stories touch the heart. So I'm going to do a wee bit of both, if that's okay. And this has been great because it gives me an opportunity to actually reflect on where we've been and what we've done and what we've achieved. So thank you very much for having me along today. And we've actually feel that we've come quite a distance and really in quite a short time when we think about it. First up, here's our definition. Richard mentioned that early on today. There's different definitions. What do we mean by a dementia-friendly community? This is the definition that we've been working with. And it's the whole community, it's everything. It's the shops, public services, faith communities, organisations, businesses, the emergency services, absolutely everything. Community leaders and activists who are committed to work together and help people with dementia to remain a part of the community, not become apart from it. And this involves learning about dementia and doing very simple and practical things that can make an enormous difference. So how did we come up with that definition? Because there are various definitions. We got our definition by, in the beginning, actually listening to what people with dementia were telling us. We had an event in 2011 when we talked about the dementia strategy. We invited people with dementia, people living with dementia, families and carers, to come and hear about the strategy and to think about what does that mean for you. And we sat at tables and we asked them questions. We asked, what's important to you in living with a diagnosis of dementia? Who is important? And if in statutory services we thought we were going to hear like the doctors and the nurses and everything are wildly important, and we were due for a huge disappointment, not one person said that the consultant psychiatrist was important. They didn't tell us that at all. They told us that it was shops, it was supermarkets, it was going out and about, it was a bus driver, it was their neighbour, that's who was important to them. Where was important? Going out and about the local communities, and why staying connected to their personal and local communities was important. And that's the kind of information we got back. And we said to people, what would you like us to do? And what do you think would make the biggest difference? And they said that if everyone understood dementia and how it impacts in ordinary life, that would make a huge difference to them going out and feeling safe and secure and still feeling part of their community. So that's how we came about with our definition. We took it from what our local people were telling us was important. But actually, that's a perfect storm, because what people were telling us was important is an absolutely brilliant match with health and social care policy and strategy. I love policy and strategy because it gives you a mandate to go and do stuff. And in the NHS, I like a mandate to go and do things, you know, and I like to be able to talk about policy and strategy because that gives me basically the foundations to go and do work like this. Because if health and social care policy is about helping people stay in their own homes for as long as possible, safely and confidently, looking at community-based approaches, community assets, using all of those fine words, building a dementia-friendly community actually breathes life into that. That's the way I felt policy and strategy can be used. It's not something that sits on a shelf. Get hold of it and use it to make it work for you. And what people told us was important was a direct match with the health and wellbeing protective factors. And it's also a match with whatever you look at as a quality of life instrument. What people told us was important to them and why is an absolute match with quality of life domains. So really, what more of a mandate and credentials do you need? So where have we got to? Well, we did start in Motherwell, but we've now rolled out, in the last 2 years, we're working across all 6 North Lanarkshire townships. And South Lanarkshire is also catching on, and we're now beginning to move into South Lanarkshire. And there's been an event held just last year with South Lanarkshire looking at how can we take forward dementia-friendly community work here. We shared our tools and learning because we did this work. Basically, our springboard was being a dementia demonstrator site in 2011 to 2013. And we shared the tools and learning because everything we've done, we've gone out, we've talked about it, we've said, you know, if we've got something that can help, we're delighted to come along and share. And there's 23 other areas in Scotland that have been looking at what we've been doing. From a church, a small group of seniors in Uplomoor, right to City of Edinburgh and City of Aberdeen, Aberdeenshire, Inverclyde. But it's an organic process. We're not, we tell our story, what we did, and see how it lands with that community. But there's more ways to develop a dementia-friendly community than perhaps what we did. Our toolkit is going to be going on to Alzheimer's Scotland website, so we're going to share that. We're presenting at the Alzheimer's Europe Conference and Masterclass in Glasgow in October. But we've shared our work UK nationally and with Europe and beyond, and we've been asked to go to conferences and deliver workshops and things like that, and just talk about what we've been doing, which has just been fantastic. But we've been so busy doing, and learning by doing, that we were too busy to actually write it up. So we're rectifying that, and we're writing a report on our work that we'll have published in time for Alzheimer's Europe Conference in October. How do we know it's working locally? Well, here's some numbers. We've got 73 businesses signed up, 500 participants, nearly 2,000 people have attended awareness sessions. I personally trained 210 firefighters. That was just a joy. And I insisted, for the sake of consistency, that I did it myself. People wanted to share that work, but I said, no, it's all right, I'll do it, I'll carry on. But that was fantastic. But we had to work in night shifts, we had to work at weekends, we had to work flexibly. We didn't go to GP practices in our first wave in Motherwell. I thought it was just too hard. So what happened actually was Motherwell Health Centre came and said, after we got a bit of publicity, we should be doing something about this. We went, yeah, all right, yep, can we help you? And they got on board, and now all North Lanarkshire general practices have been taken to informed practice level in promoting excellence and have had environmental audit done, and they're engaging with the dementia-friendly community ethos. We have a Football Memories project in Motherwell Football Club, and 1 month after we launched in 2012, we had an event for the Football Memories project. We thought, well, we'll ask people to come along, football fans, to bring memorabilia, and we thought, well, probably about 100 folk if we're lucky. 500 folk turned up on the day, we were absolutely overwhelmed. We took that as an indicator that talking about dementia in Motherwell was actually beginning to get through to that community. And people came with their children and families, it was fantastic. Another indicator, Asda, one of our partners in our first wave, signed up. We've now got 297 free support workers, that's the staff in Asda. And they have the green box thing. MD an Asda shopper, you do your green box voting. Our dementia cafe was one of the projects. It was up for a vote. They accepted the box 3 times. We took that as an indicator that Motherwell people were beginning to get interested and were responding to the dementia agenda. We use mystery shoppers for our shops. People with dementia will go in, just see what happens, and then they'll come back and tell us what their experience was. And we've had fun with that. People love doing it, being a mystery shopper. And we go and we ask people for quotes and for stories. And we also have dementia featuring regularly in our local media, local newspapers and things like that. So we gather all of that as evidence. So it's coming from lots of different sources. But we've also had national and international recognition, which is fantastic. We've got lots of awards, just brilliant. We got the Scottish Dementia Award for Best Dementia Friendly Community last year in September. And just this year in Brussels, we were absolutely delighted to get €10,000 and the EFTA Award, that's the European Foundation's Initiative in Dementia. And we were awarded €10,000, which we're using now to turn into work with our BME and faith communities in North Lanarkshire. And I was also filmed for a Norwegian telethon in October last year. Norway came over and filmed our work in Motherwell, and they used that film in their telethon last year, which was all about dementia. And their telethon raised far more money last year than they've ever done in any previous telethon. So dementia, friendly communities, we've shared our work with Norway. So our learning really, it's all about the P's, it's about people, it's about teamwork, it's about preparation, planning, passion, and being able to prove it. So I'm just going to very, very quickly fly through what we've shared a wee bit of our learning from the work that we've done. Critically, any working group or steering group, it's got to be partnerships. You're equal because you're there and contributing. It's not about who you are or what you are, how big you are. You're there and you're equal because you're there. That's it. And our working groups are for the statutory service, public and third sector, people with living dementia, and more. But link the work up with national and local policy and strategy. That helps you with your statutory partners. And this is the real 2020 vision as far as I'm concerned. The NHS 2020 vision. We're living it, we're walking it, we're doing it. And also the work resonates with co-production, asset-based approaches and community capacity. Get the right people in your team. Basically, everybody's equal, but the qualities and attributes of people here are so important. You need people that know about dementia and have skills in lots of different ways. Our hook was customer care for our businesses. So you need a variety of people with different skills, but all is about communicating, willing to work flexibly. I've worked nights, I've worked weekends. Visionaries, absolutely you need them, but people that love detail and practical hands-on people who want to go out and just do the show everything and get out and about. But everybody has got to have that humanity. That's what binds us, is humanity. Warm, friendly, engaging, energetic, and would be inspiring. Preparation's everything. What's your community? It can be anything you want. But define it first, research it. What do you know about it? What are the local social and community issues? Get your data and facts and figures. But who are your community leaders and activists? These are the people you want to bring in. The folk that get out there and shout about, we want it to be better. But link into other projects and initiatives that are underway and think about links with EAT. And build on your mainstream groups. It's all about inclusion. We planned our campaign, what was manageable. We didn't, it could be so big it could be overwhelming. Start manageable and think what's going to have the biggest impact. Research your businesses, that's what we did. Boots said legendary patient care. We went and spoke to them about legendary patient care. So research your business and go for people who like to be first. And we made promises. They made a commitment to us and we made commitments to them. So it's a win-win. Dementia's on our logo, we thought it was important because having that on the logo basically opens up the conversation about dementia. So we start talking about dementia openly and that helps with reducing stigma. But at the end of the day, it's about passion. That's what we've learned. This is about passion. And if you're passionate about this work, you'll inspire others to action. Proof of concept, absolutely. We think dementia-friendly communities is a good idea. Because if good ideas have legs, they travel well. We've travelled to Malta, and to Norway, length of the UK, Ireland, Europe, and I've got interest in Canada as well. Good ideas have heart. Dementia-friendly communities appeal to hearts. They connect with people's values and connect with what matters. And they have hope. Because we talk about dementia, not about dementia as the disease, we talk about the possibility and potential. And that's a different kind of story. And they're powerful. Good ideas are powerful. They shift thinking and behaviour, they have impact, and they bring sustainability. And that's what we're beginning to deliver. And I'll leave you with a quote from Margaret Mead. Doesn't matter where you start. Small group, thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And we feel we're changing the world. And we're all part of that, and that's just brilliant. Thank you very much.